We've been serving Snohomish County for that whole time. We've through the pandemic and because of remote capabilities, we've been able to, or because of like Zoom calls and things like that, we've been able to reach people in Whatcom County and even North King. But most of our work is oriented towards Snohomish County. We're a mission-driven organization, as it says there. So our mission is to provide services that promote quality of life for individuals living with a mental health concern in a manner that facilitates growth, independence, and a sense of community. All right. So our model's a little unusual. Well, not unusual, but maybe a little different from the conventional business model of a nonprofit or a for-profit. We're what's called an employment social enterprise. So essentially what that means is we have two sides of our business. We have our contract manufacturing and we have our clinical services. And so the contract manufacturing helps to pay for the revenue generated from that, helps to pay for the clinical services programming. About 50%, a little over 50% of those within our contract manufacturing are considered MBEs, or mission-based employees. Those are people who would identify with having a mental health concern. And then on our clinical services, we say we employ those with lived experience. That applies really agency-wide, but clinical services as well. We employ those that have lived experience. That's been a new initiative that we've done to kind of to really lift up that lived experience is equal to either job experience or education or things like that. So it's a way to kind of provide greater access to employment for those that may not have the conventional skills or background. So some technical kind of language around it is ESEs are transformative social impact through jobs, training, and support for people that maybe conventionally have been left out of the workforce. So that's kind of how ESEs function. One kind of example of what we have within our organization, within our agency, is our AJAC program. So that's a upskilling program. It's a job training program that works with the Aerospace Joint Apprenticeship Committee. They're a nonprofit as well in Snohomish County. And that provides opportunities for those of who work in our manufacturing, who work in aerospace, an opportunity to upskill. It's really a way for us to kind of live our values and provide opportunities for upward mobility for those who we employ. This is just kind of our impact, some of our impact numbers. I actually printed those out as well. They're in those folders that I put down there. There's a few other numbers as well, but these kind of some of our top line numbers that we're proud of as an agency. We've got 562 community members that were served through our clinical services program in 2022. 207 of those were individuals, were given opportunities through our employment services. 177 were given access, this was 177 individuals and families that were given access to safe and sustainable housing through our housing programs. Our Everett MAP Court program, proud of that recidivism rate at 92%, and 92 individuals were offered a path to recovery and stability rather than incarceration through our therapeutic courts programming. So there's some top line numbers. There's more in that sheet, so I welcome you to take a look at those.
Quick question for that.
Yeah.
So the 92 individuals offered a path to recovery. How many of those accepted the offer?
Yeah, so the 92 is the amount of individuals that went through our programming. I guess that language is a bit vague, isn't it? It's some of our marketing language that's maybe not quite as clear as it should be. That is the amount of individuals who have gone through the programming, through our therapeutic courts programming, that have received and accepted into the program.
Great, thank you.
Yeah.
So I have one question, and
Yeah.
you might be going to talk about it. Oh,
Yeah.
I think you are. You're going to talk about the housing options that you guys
Yes.
have? Okay, never mind.
Yeah,
I'll wait
Roger will dive into some of the.
to ask questions.
Yeah, no, I love. This is great. I love this. Yeah, this is great. Thank you. Good timing. So I'll hand it over to Roger to kind of talk about FCS. So that's one of our kind of core program offerings.
Yeah, so we've been doing supportive employment case management services for a while. In 2019, we converted over to a Medicaid-funded supported employment program. Again, it is case management, so it isn't like we have a stable of employers that will hire our folks, but it's based on the premise that anybody who wants to work should be able to work. So it's kind of a low barrier way of getting people employed. In 2020, we took on supportive housing case management. So again, that's not something that we have apartments. We used to have apartments, apparently.
We did. Yeah.
But we have case management services that will walk folks through the whole process, whether it's going down there to apply for the 211 services, hold their hand while they're waiting to get served through the navigators, going down there to get housing vouchers, hen vouchers, those kinds of things, helping them fill out applications. Some of our housing subsidies that we have had helps pay for some of those fees. As apartment landlords can charge a fee for any time you want to make it an application to live there, but they don't necessarily have to let you live there. They just have a fee. So, our folks, they can't afford that kind of stuff. When I got there, we have had a mental health alternatives program for about 10 years, since I think about 2014 or 15. It was, at that time, primarily through the Everett Municipal Court. I think it was funded at that time through the North Sound, what's now known as the North Sound ASO. Mm-hmm. Soon after that, the city of Marysville got interested, and they also funded the MAP program. So we operated MAP in 2 cities, where in a diversion context, we help folks stay true to their recovery plan. So we would follow them along with making sure they go to the treatment provider. We would give feedback to the courts. It's really an amazing process for me to see, because I go to court and I get scared to death. But in this process, it's like a team. So you have the liaison there, you have the defender, and you have the prosecutors who actually talk to each other, and then you have the judge, who is very, very. It strikes me, especially in Judge Leonard's court, especially that court, very strength-based, which is a good thing, because people just need to have that support and positive affirmations for themselves. I'd like to point out here, there's something that we've tried to institute as far as a thinking process, and I go back to something that I used to see as a kid, a younger man. You picture some guy climbing a mountain and trying to get to the top and getting the guru up there to say, give me the meaning of life. Well, in this particular case, I had 2 CEOs ago that I used to work with, used to say, ask us, what's missing that, if present, would make a difference? So that's identifying what the gaps are and what would make a difference if we had something in there. We have to find the money for it, but let's figure out what we did. So in that respect, the MAP court actually worked with the municipal court in Marysville and in Everett. Those 2 courts combined to get a contract through the Administrative Office of Courts, AOC.
Correct.
AOC.
I get confused with our Congress.
Acronyms.
Yeah. And we were successful. We had our first year last year. The main goal is we identified that it just takes so long for somebody to get a chemical dependency or an SUD assessment. And you can't do anything with treatment until you get the assessment. So what we did is that we said we would hire an SUDP, a professional, that would do an assessment that meets the WAC requirements, and we could do it on the spot. So on the day that you have your docket, we're able to actually provide that assessment in a confidential space to get the ball rolling. The second thing that I think this year, it's only with the Everett Court, Judge Leonard is the presiding judge here, that Without that assessment, you can't get people into treatment, but sometimes treatment providers are still, I use that word still, because it used to be written into the WAC that everybody had to do their own assessment. So I could do an assessment here, and I refer them to Michael's place, and Michael has to do an assessment in order to even get considered for admission. So our SUDP, Margaret, is trying to break that door down. So that's one of those kind of things that, if present, what we get that person into treatment sooner. Kind of the focus that we're doing there. The Tulalip tribes, they
Yeah.
invited us in to try to start a map court in their tribal court. We were successful in doing that. We're going down our second year with that.
Yep.
Yeah. We're very happy with that one. It's different than all three courts, because now you're
Right.
dealing with a sovereign nation and the way they do the tribal courts. And they don't make a distinction with the type of crime. So they could be very serious crimes as well as misdemeanor type of crimes in that regard. You made mention of the PATH program. So we,
Yeah.
it's an acronym. We're famous for acronyms. But don't blame us, blame SAMHSA. This is a SAMHSA funded and supported program. And I'm glad you wrote on here, I'm glad you wrote down what the acronym stands for, so I don't have to remember that stuff.
I've had to memorize it. I have to say so many times.
But it was the first time that we thought, well, do we really need to have someone with a college degree, a BA or a master's degree, to actually do the service? And we thought, no. We should try to take a look at people that actually have walked the shoes of someone that is chemically dependent and homeless, et cetera, et cetera. So our two PATH outreach counselors are people with lived experience. They don't have a college graduate or a BA degree. And we found that it works pretty well because they can really identify with folks that they're going to see. There are folks that are homeless, that have a behavioral health issue, that aren't involved in any services at all. And their task is to get them involved into services with a focus on folks of color and veterans. It just so happens that the guy that leads it, Keith, is a combat veteran. So, and he makes that distinction, by the way, that there's a difference between veterans. He's also a utilizer of veteran services in the past, so he knows his way around to get people. We have a fellow that he highlights that the description is that he came down from the hills, literally, because that's where he was living, reluctant to get any kind of services, and don't tell me about the VA. But after a little persistence and patience, he eventually convinced him that he should try it. He got involved with the VA system. He's now housed because the VA does have money that can house veterans. Very good story. I asked those folks that were doing the PATH outreach, so you know the system. Basically, you find them, you refer them. What's missing that if it was present would make a difference? And they said, you know, after we've referred them, there's no guarantee that they will follow through because there's nobody to take care of them and see them through the whole process. So it's kind of a description of a care manager, if you can think about that. And that was the basis of our application to the city of Everett that in a recent RFP, our funding had to do with providing care management. And we were fortunate enough to get the nod. That care management program is up and running now. We're in our second month. We're just ready to hire the second care manager to make the full complement for the services, to actually walk with the person as they try to get themselves out of their predicament that they're in and they're homeless. We're very, very happy about that.
I just wanted to just mention that that's what the COE, I'm sorry for the acronyms, the COE CMS is that City of Everett Case Management Services, what Roger's referring to.
So it's not only SAMHSA that gives us the acronyms, it's him. He does.
I have one question on that. So how much time does the care manager, like is it daily that they're with these folks, or do they just, or is there just no rule with how much time each individual needs?
It's really up to us to decide that and up to the client need or the individual
Okay.
need.
Okay. Just curious if there was a
No.
kind of an average or anything, no?
Well, we're just in our second month.
Yeah,
I think right now we have Diane, who used to be on the PATH team, she converted over to the care manager side. Currently, she has 14 active clients.
Okay,
Yeah, so she's trying to
That's-
see, and she's very good. The PATH team, they don't necessarily have to do this, but they will drive somebody to detox just to get them in, because if you don't take care of that opportunity on the spot, it's gone.
yeah.
Margaret from Judge Leonard's court will do the same thing. It's really not something in our first year that it was called out that you needed to do, but that was the missing piece.
Gotcha.
And the last formal program that we have is the mental health clubhouse. Clubhouses have been around since the 1940s. It's something that I studied in school. In Washington State, they had all 5 service delivery models that I studied in graduate school, so I was so tickled. I really loved that. Clubhouse was fully funded by Medicaid services so up until about maybe 2010. I don't know what happened. They changed the coding and it no longer became funded, so all the clubhouses in the state disappeared, where there's only maybe 3 left in the state until the recent movement to try to get them back. So with seed money, we opened up a clubhouse in Marysville. There's also one run by another organization in Everett, 19th, somewhere there.
Yeah,
Yeah.
19th, yeah.
I'm not from the city of Everett, sorry, so I don't know my way around. I get lost.
It's 19th, yeah.
Yeah.
Hero House, they're an extension of Hero
Yeah.
House. Hero House Northwest.
It's kind of a relative of the recovery cafes that you might have heard of. It is not a treatment service, so it's not an outpatient treatment program. It's not a drop-in center, but it's a place that's member-driven and with the focus on trying to get folks engaged in their community to eventually, if I could use an old terminology, because I'm kind of old in the field, to help them become potential participating members of their community. That really is the goal for that. And you do that through employment services, and now we have to, we're going to try to take a look at housing. So there's graduated ways to get somebody to employment. You just don't throw them in a job. There are things called transitional employment placements. We've been lucky enough over the past 3 years to get subsidies available to us that we manage. So we've had one that's comes another acronym. It's CBRA or CBRA. I hope you put the name of that one in there.
Yeah, community-based rental
Yeah,
assistance.
we had a thing called SABG, but that expired last month, and we won't talk about it too much. CBRA does support permanent supported housing. So we have folks that have been housed for 2 years because of that program. It's very limited for us, so the funding we get every fiscal year at the state supports those people that we've housed. So we haven't been able to add new people to that program. The other ones we have are more like bridge housing. So there is a thing for FCS Medicaid individuals called TAP. What is it?
That's a new one for me. Sorry, Transition Assistance Program.
Thank you.
Yeah.
Which helps with the first and last rent. It doesn't pay for the rent every month. It'll help with fees, help get IDs, pays for move-in costs. We haven't had a person that we help pay for some legal expenses because he got evicted and he had fines with that. So it's very flexible. The unfortunate thing, after 3 months of having the availability of this year, the state has run out of money. So it's really sad. Hopefully they'll find more money so we can continue that on, but that is something that we've been managing. More money for, sorry. It's for TAP. Yeah. That's monies that are coming from the Department of Commerce.
Mm-hmm.
Sorry, and you said that you weren't able to add more people to CBRA. It was also because of money?
It's because there's a limited amount of money that we have, and if you house somebody, because it's permanent in nature, you keep funding them throughout the course of the months and years. Trying to get them off the subsidies, of course.
Is that state funding too, though?
That is state funding, yes.
Okay.
The last one we have, which generated a lot of interest and still is, I think the person that managed it, Melissa, says in just the last hour she had 15 emails inquiring about a program called HARPS. housing assistance rental.
That's the other, one of the two is TAP and HARPS that I'm not as familiar. Housing and recovery through peer services. That's right.
Yeah,
That's,
I rely upon Michael to keep me honest
sorry,
here.
it's those two that always get me.
That one is pays for bridge housing. So bridge housing is basically short-term housing in hopes of getting them out of, quote-unquote, out of the rain and on the path of trying to get their lives together to get housing, which is not an easy task. Largely, some of our subsidies, including, trying not to do this solely with HARPS, is that we've utilized motels to try to get them out of homelessness, and then work with them to try to get their subsidies together. Especially HARPS, it is for folks that are in an inpatient treatment facility, both mental health and substance use, and to get them into bridge housing. So the best way we found that we can do that is we don't let them get homeless in the first place. That's what we did with Zebra. Whether or not we can do that with HARPS solely, I don't know, but we're focusing in on recovery-based housing because some of the treatment facilities are already identifying that if there's a place to go there, they need funding. So then that's when we come in and try to help fund that. Did I miss anything?
That's it. That's I think pretty much all of the programming that funding and programming that we offer.
5 years ago, it would have been a shorter speech, I
It
think.
would have been a shorter speech. Yeah, we've added a lot in the last few years. We have. What was the staffing number? We've tripled our clinical.
Yeah, we had 5
services.
employees at that point in time. This is just as COVID was hitting. 737 MAX was also hitting.
Which-
We won't talk about that.
Which we work in aerospace on our manufacturing side, so.
Yeah, currently
Yes.
we have about 17 going on 18 staff that is involved in all these programs. I don't want to put you on the spot, but I have to tell you that the one day I sat in court with there, it wasn't great. I don't know. I was really
It was
impressed
awesome
with
to
your
have you
court.
there. It was awesome to have you there.
Yeah.
I'm going to open it up for questions probably, but obviously I preside over Therapeutic Services Court. I have a big background in wellness courts because when I was with Tulalip as a tribal court judge there, I presided over the Healing to Wellness court, and the tribes are phenomenal about making sure that we are well-trained. So I've been able to attend several annual National Drug Court training all across the country, and actually pretty proud of Tulalip in that court because we were nationally recognized. So there are 576 tribes in the United States that are federally recognized, and there are only 2, including Tulalip, that are mentor courts and federally recognized mentor courts, and Tulalip became one of them when I was presiding over it. So I've had a lot of background in that, and so that's why when I learned that I was going to take over Therapeutic Services Court for Judge Van Slyke, I was very excited. Just like both Michael and Roger probably mentioned, Tulalip is very different because there are different rules. Their law is very, very similar to Washington State, but tribal courts and sovereign nations are not bound by state law at all. They are by federal law, but not by state law. So because of that, the tribes have some control over what their court procedure is, and it's a little bit different than state court in that we can do a lot of things when someone's in pretrial status that we cannot do because of the Constitution of the state of Washington. So our Constitution in Washington is a lot more protective of people's rights before they've been convicted, and rightly so. The concrete example of that, just to kind of give you a sense of what I'm talking about, is in Tulalip, for example, every single person that comes into Tulalip Tribal Court because they've been arrested, if there's anything about that offense that is drug-related at all. It can even be a domestic violence charge, for example, that has a person who has substance use disorder, that's the offender. We can order them to get an assessment, an SUD assessment, and be in compliance with treatment pretrial. And that is something that cannot happen in Washington State. So that's why the Therapeutic Services Court is very unique. So when someone comes into our Therapeutic Services Court, and I suspect you're curious about how that happens, they are typically referred by their attorney And it's almost always a crime related to their substance use disorder. Obviously, the most common would be criminal trespass second degree, public use, drug loitering, and probably the soda order violations. So those are the most common defendants and offenses that we see in therapeutic services court. So it's really any person in the system, so whether it's the judge, the prosecutor, or the defense attorney, or even a probation counselor, could potentially refer someone to TSC. But really, it comes from the defense attorneys, because since that person's in pretrial status and we don't want them making any admissions about what they've done because they've not been convicted yet, really the person that's able to have those types of conversations with them is their attorney. So sometimes it might even be identified by a prosecutor who might then go to that person's attorney and say, hey, I think this person might be a good fit for TSC. What do you think? But most of the time it's coming from their attorney, who can have that confidential conversation with them. Hey, are you struggling with substance use? Okay, it seems like it. Sure. Are you interested in getting clean? What does that look like? Well, here's this option for you. So it mostly comes from defense attorneys. Typically, they'll get referred. They will come to, instead of a normal pretrial calendar, they'll come to my therapeutic services court, which is a pretrial status type hearing, and they're not in yet. So they observe. I'll call them up, talk to them. It's unusual in comparison to wellness court, because with wellness court, that person is post-conviction, or they've waived all of those rights before, and so I'm able to speak very freely with them about what's going on in their family, and like the motivational interviewing type questions that I can do to get to know that person, to figure out what's motivating their change. What do they want? I can't do that in TSC, so it's somewhat of a challenge. But they come in, they watch, they listen, they see people at different stages in that progression. But really, our whole goal of therapeutic services court is to get the person assessed, just like Roger said, very quickly, and get them to detox and to treatment very quickly. It's not like a wellness or a drug court where you're seeing the judge every single week in the first stage, you're having a lot of judicial contact. That's not the model. So it's a sequential intercept model, which is get the person assessed, get them to treatment, and then as long as they work with treatment and they stay in compliance, they only see me at the very end when they graduate and their charges get dismissed. What we have found, though, and how we've morphed over time is, and anybody who works in recovery knows that it is not a linear path to sobriety at all. And it involves a lot of slips and slides along the way, a lot of relapse, and that is a normal progression for anybody who's struggling with, especially with fentanyl. And so instead of doing the first step is the therapeutic services referral, so they get referred, that document protects everything that they say to the substance use counselor who's doing, Margaret typically is doing the assessment, sometimes other agencies as well. But that way, anything they're saying can't be used against them by the city if they choose not to go through the program, because we want to make sure they have options. It's a voluntary program. So they can get assessed, and if they stay consistent, then we'll get them to treatment. We used to enter their agreement. The agreement legally, essentially, what it does is so the person, it's similar to a stipulated order of continuance or a prosecutorial offer of diversion, where I make sure they understand the rights that they have as far as a jury trial. They waive that right. They agree to get the benefit of this program. They're going to waive their rights and go through the program and be in compliance. And if they do, at that end of time, whatever their evaluation, everybody's different about what their level of need is. But once they get to that point, then if they're successful, their charges are dismissed and they've been through treatment. And so they've stabilized. Obviously, that's very oversimplified. That's the goal. But what we found is that we were entering people with that document into the program prior to going to inpatient. And then what would happen is they would leave inpatient, because that's very common. Sometimes people, we've fought so hard to find them, or Margaret has fought. She is a miracle worker, but she's fought so hard to find someone the right treatment. Sometimes something very rare, like a 4-month treatment program where the person can have their child with them, and then they walk in the door and they sneak out the back within an hour. It's voluntary. They can leave if they want. So we see that a lot. But what it meant legally is that when they would come back to us, then we weren't sure quite what to do about that. If they wanted to continue and try again, then we would have to extend that. And so what we learned, and what I think is a better practice, is we keep them in pretrial status as they're going through detox and inpatient. Then once they get out of inpatient and stabilize, then they enter into that legal agreement, and then we have the months of how many ever months their level of care is. So that's kind of how it works, nuts and bolts, just generally. Just to give you guys some idea of numbers, and then I'll open it up if you guys have any questions. But we're very new. This is our second year, and we have had 51 total participants so far, 5 of whom have successfully completed, meaning they went through treatment, they stabilized afterward, meaning it stabilized in every way, whether it was with housing. There are a lot of folks who have co-occurring needs with mental health and substance use, which is obviously not surprising. If they seem to have more mental health needs than substance use needs, then I might hand them along to Judge Kastner's MAP court, because it might be a better fit for them to have more case management support in that way. But for our folks who are primarily substance use disorder folks, then they go through that process. And so those 5 successful participants it doesn't sound like a great number, but they're very heavy utilizers of court services, of community services, whether we're talking about between the courts, between police contacts, between, even medically. And so getting 5 people stabilized is pretty profound, particularly when their families come to that last hearing, and you have parents who are saying, we actually were planning for her funeral, and we were buying a funeral plot because we knew she was gone. And we're talking about people often who are like 19, 20 years old. And they come to us and they're like, I never thought we'd get our daughter back, and here she is, and she's back. She's back in our lives, and she's, and just the physical transformation when we see people, they come in and it's like, wow, oh my gosh, nice to meet you. Like, it's such a wonderful thing. The other thing that I think is important to remember, especially some days when I have those days where I feel like the need is so great and we're not touching enough people. I sometimes have this feeling of being in a hole with sand falling in, and I'm shoveling out the sand, and the sand just keeps falling into the hole. But we have to remember that, and I think Kathy Wheatcroft pointed this out, that, and I remember once she said it, I'm like, that's right, I learned that at one of our conferences. But evidence-based, everything that we do in wellness is evidence-based, and evidence shows that anyone, even if they don't successfully complete our program, their recidivism rates, they're better off for having gone through our program. And we have decided as a team that we're going to allow individuals, if they get new charges, to come through as many times as they want. I'm not going to say you get one shot and that's it, which used to be the way that the system approached this. You get one shot and that's your one chance, tough luck. We don't do that anymore because that's not real life. So yeah, of those folks, of those 51, we've only had 10 people reoffend at all in any way, which for a lot of people who weren't successful in the program, I think is pretty telling. We're talking about people who, I can think of one young woman in particular who, she was in her mid-20s, and I think she had 52 criminal charges. And so it's a lot. There's a lot going on for each of these individuals. So that's what we're doing. We're still learning. We're still trying to figure out our path and how we're dealing with folks, but we just take it day by day. And even when folks decide, this is not the route for me, I want to go back to pretrial status, I want to go back to the pretrial track and just go through the normal part of it, I always tell them, we're here Friday at 9 a.m., you guys know that by now. Oftentimes they come a lot to court every Friday in the beginning because they really, really need, to be honest, they just need support. They just need to be heard and seen and understand that this isn't a typical court type hearing or typical court process. And I always tell them, just because you're not doing therapeutic services court doesn't mean that you can't continue to seek sobriety. And that's what I want for you. And if you need a pep talk, you know where we're at. And if you need to feel community, you know where we're at, Friday, 9 a.m. I know it's early. It's early for me too, but we're always there for them. And that, I think, makes a big difference. And I've had so many people who, even though they've not successfully completed and had their charges dismissed, they tell me that they're telling all their friends on the streets, they're out on Lombard buying fentanyl, and they're telling all their friends, if you want to get clean, Everett has a thing you can do. If you get any charges there, think about doing that court. And they always just call me the blonde-haired judge. So they're like, it's the blonde-haired judge. So I think we are making a difference. We're only in the beginning of our second year, but this is what we're trying to do.
So, do you find that there's a shortage of treatment? And do they go into treatment bed centers so that they spend the night and I keep hearing there is a shortage?
Great questions. It seems to go in waves. Margaret Smith would know better than I would.
Okay.
She's our everything, to be honest. She has a magic way, though, of finding it. Now, she has lived experience, and that, I can't tell you how valuable that is. She is able to communicate to us things that I couldn't understand because I've never suffered from substance use disorder. So I've loved people who have suffered from it, but I haven't lived it. And she has this magic way of knowing what someone needs, knowing how to find that treatment center, and then really kind of calling in all her favors with treatment facilities. But I've seen sometimes she'll come into court, it'll be, maybe in the summertime when need is a little bit less, and say, there are tons of beds, who wants to go to treatment? I've got a lot of options for people. And then the fall comes and it starts to rain and it starts to get cold and things start to change for people who are homeless. And then all of a sudden it's really hard to find beds, and it just sort of goes in cycles.
Are they all in Everett, or are they?
They're all over the state.
place?
Mhm.
All over the state?
And sometimes other places too, but that's a little more unusual. We have that a lot at the tribes, because the tribes, if someone is unable to get their insurance to cover it, or the state insurance won't cover the type of treatment they need, the tribes will jump in and pay for it. So we had a little bit more options there. We have a little bit fewer options, and so most people stay a little bit locally, but everywhere. Sometimes PCN, which is Pioneer Center North, sometimes over in Spokane, sometimes in the middle of the state, sometimes south. Obviously, I'm sure you all know that it's good to get someone out of the setting that they're using in, away from all of their triggers, to make sure that we want to set someone up for success, right? We don't want to, it's unrealistic to think anyone's going to be able to make change if they just go right back into the same situation again. So
Right.
often they're going to be going to treatment away. And yes, the minimum is usually about a 28-day. That seems insane to me. I think that realistically, if money weren't an object, and if we were really focused as a society on getting people better, it would be a lot longer time than that. So we've had participants do the basic 28, 30-day kind of treatment inpatient, followed by intensive outpatient, and then relapse prevention. That happens in the community, those last two steps. Or we've had some people who have gone to, unfortunately not stayed yet, but some people who have gone to longer term facilities, like that 4-month program that I'm talking about, where you can bring your child. And so if you have court involvement dependency-wise over in Superior Court, then you might have options to be able to help reunite with your child and get the rights to your kid back, because, hey, look, I'm going through treatment. I've set it up so that the folks that are in that facility can help me relearn how to parent in real time, like with my child as I'm doing treatment. So there's a ton of different options. Paying for those options is a whole nother thing, but that's where Bridgeways comes in, to work their magic to understand and navigate that system that I know very little about. But I rely on Margaret heavily to do the work that we do. Yeah, she's awesome. I mean, she picks people up that I release from jail. Some people can be released from jail and be successful. They can come to court and they can make the choice to do their assessment, and they can get the medical needs taken care of, because you can't go to inpatient if you have medical issues. And if you're using fentanyl, you have medical issues. Typically, you've got cellulitis, you've got limbs I've seen people with the amputations. We're talking about some pretty dire situations. So we have to get that taken care of and then get them to inpatient, and Margaret will do whatever it takes. She picks people up from jail and gets them to detox. She takes them to get clothing. She takes them to get ready, all the things that you would need to get ready to go to inpatient, especially if you've been unhoused for a really long time. So that's kind of like what Roger's talking about, just filling in all of those gaps and removing every barrier. And we are learning along the way too. We used to try to get people phones, because contact and staying in contact with Margaret is really critical, because she's got deadlines, and if she's got a bed date, she's like, oh, this would be perfect for, Mr. Smith or Ms. Jones or whomever, and she can't get a hold of them because they're unhoused. It's pretty tough. So then we learned pretty quickly, the Carnegie Center gives out phones, and then we also learned that that phone will usually be in that person's possession for half of a day, and then unfortunately, they will say it's stolen, and they've almost always traded it for drugs, because if they don't use, they get really sick. And so we have had to get really inventive about that and just tell them, walk to the courthouse, you can use a phone. Go to Bridgeways, you can use a phone. Go to your attorney's office. Your attorney's office, the public defenders are so awesome. ELA, we're so blessed with them. You can use the phones there. And, or just, come here on Friday. That's the biggest thing. We all know we'll be together on Friday. So those are some of our big challenges that we have.
Well, it was nice to hear you talk about the post-recovery kind of help that they can get, which I was curious about, because you've only been doing this for 2 years, but the long-term
Yes.
programs would be so important, so.
And it is a part of the program. So we have levels of the court. There are, it's all, of course, needs-based. Some folks may come in, and we haven't seen this typically, they're going to get assessed and they're going to be level 5, which is the most need that you're going to have. So that means that after they're done with inpatient, they're going to need to have 5 compliant, month compliant reports in intensive outpatient, and this is all, we don't decide as the court what's needed clinically. We rely on the evaluators to tell us, okay, well, what does this person need for treatment? So if they say this person's going to come out of inpatient and they're going to go into intensive outpatient, so that means this many meetings and this many group, and this many individual sessions per month. I don't have any contact with that part of it. All they have to do is stay in compliance with that every month. If they fall out of compliance, Margaret lets the court know, and then she makes a motion for show cause. And then if I think that this person, we should bring them in, because we want to stop that slip before it becomes a slide, right? So we might pull them in and say, hey, what's up? What's going on? And then I give them the pep talk, and we talk about, okay, so relapse is a part of this, and if that's what's going on, let's get it taken care of. Have you told your counselor? And really trying to stop that from happening. But they're going to have to be in compliance for whatever their length of time that's recommended initially at the outset. And that is going to, like you're saying, that's going to really set them up for success. Because that's one thing I don't think is fair, is to give someone one tool and expect them to be able to become, like Roger said, participating member of the community with that one tool. It's unrealistic. So.
Especially when they don't have any support from family or friends and stuff.
Absolutely, right. And when you're in active addiction, and I have lived experience with this, if someone that you love is in active addiction, they are burning bridges all over the place because they are lying, cheating, and stealing and doing whatever they have to do to get their drugs. And so that's where they lose contact with family. And that's why when we have our graduations and their family members come back and they're like, I hadn't seen my daughter. I used to drive around. I used to drive up and down Evergreen, or I drive up and down Broadway just to try to get a glimpse of her to see if she was still alive. And then they're being able to reunite and reconnect and be a family again. And it's really, too, with addiction especially, it's kind of the opposite of that lifestyle is reconnection. And so that's that part, that aftercare is the most important part if you want somebody to really continue to be a success. Yeah. Yeah.
Yeah, we're good. Go ahead.
I had a question. You had mentioned previously something about housing and that you don't do that anymore. What was that a reference to? Did you actually run your own?
This predates both of us. Apparently Bridgeways had a couple of apartment buildings that in 2019 they sold off for whatever reason. I wasn't with the organization at that time.
Michael, did you want to add anything?
I was just thinking, I don't know that there's much to add. Yeah, we ran that for a long time. That was, I think it was well over a decade of running that housing stock, and then it was sold off. That was my CEO, my current CEO's predecessor who made that decision. I'm not sure it predates us, so I'm not sure the motivation for it. But there is obviously a high need. It's something that we've been aware of and looking at, trying to find more affordable housing for folks, even considering ourselves, how can we be more involved in that effort? Because it's definitely a high need.
I agree. I was at a, excuse me, like a think tank today talking about housing, and the person I was sitting next to is the housing case manager for the DOC, and she was talking about how critical it is for people who are exiting jail to have a designated safe space to go to, instead of returning to their street family and returning to a situation that led them to be justice involved. And that in King County and her previous role with Plymouth Housing, the state had some I guess the nonprofits had some set-aside units in a larger complex specifically for people who are exiting jail or justice involved, so that so it's not necessarily like the entire building, but there's at least a set-aside number of units so that people had a safe place to be, and so that case managers can find them and just have a bit of stability as they work towards restorative justice. So I'm not going to tell you guys what to do, but if there's any way that there are discussions about moving back into that, I'd be happy to support and help in any way I can.
Yeah, absolutely. We'd welcome that support and discussion. That the numbers bear that out, right? That the statistics bear it out. That the housing first model, it's first and foremost the most important thing. We start with housing. People need. It's Maslow's hierarchy of needs, right? It's just the basic things they need to be housed, and then they can begin to get their heads around everything else that they're trying to manage, right? You often see that with folks who are low income. It's like they can't even get their heads above water. They can't manage. You can't think about getting, clean or whatever if you don't have the basic needs. So yeah, that's certainly something we're trying to be very intentional about. Yeah.
Great, thank you very much. Any last questions or comments? Councilor
I
Tui?
just have one real quick. Most of your funding is from the state, is that correct? The federal or the state?
It varies. Some from the state, some are passed through like federal programs. So it kind of depends on the specific programming, the specific service, I would say.
Okay.
FCS is obviously pretty straightforward. TAPS, Zebra, HARPS, those are pass-throughs. But yeah, it comes from an array of places. City of Everett, of course, is and some of that money is a pass-through as well. So yeah, so it's probably accurate to say that's state or federal.
Yeah, and then you have your employment stuff that helps. Yeah.
FCS, yeah.
Well, great. You guys do amazing.
Thank you.
So much.
I just wanted to thank Councilmember Tui for inviting us. This was great. And my CEO wanted to extend her apologies. She's not feeling well, so she decided to not get everyone else exposed to anything she might have. So we're very appreciative, and of course Judge Leonard just being an advocate and being an ambassador for Bridgeways. That's amazing. So it's very cool. So thank you.
I would say if you haven't been to her court, you should do it.
Fridays at 9.
Fridays at 9.
Great, thank you. And thank you, Judge Leonard, too, for being here today. Getting that clearer picture of how folks move from one group to the other was really helpful, so thank you. Appreciate
No
it.
problem. It's complicated, and I try to make it less complicated, but it's stuff that if you haven't been involved in it, you would have no way of knowing, and we're still learning, so.
Great, thank you. Thank you. So the other agenda item that we have is a discussion about discussions. You guys are welcome to go. So I'll turn it over to Jennifer.
Just really just kind of the usual sort of what you might want us to try to schedule for the next few months, or the next month, I guess. I'm not sure how, I guess it'll kind of depend on a lot of different things, but in the new year, how we'll manage committees. If we'll probably keep running these until something changes. But yeah, we had some pending items, a lot of them, some of them are from, many months ago. So just if there's any any that are still hot topics or that you've got kind of more clarity on, that'd be great. Otherwise, I'll just keep working with staff. So we have a few that were guest related, so Everett Community College Early Learning Center, Summer County Human Services, Providence Medical Center, kind of like a guest, but report on successful projects like Claire's Place. We did have folks from Palette come that were sort of in that report on projects category. City COET briefing, and then some other issue areas, so local crisis triage, food resources, homelessness prevention, that had been tenant protections and rental registry. That might actually come from your brainstorming list from way back when you guys did your retreat and work on issues. Yeah, and then the last one that's on there is addiction treatment options, pathway gaps, things like that.
Great, yeah, I think I had a chance to meet with the new president for Everett Community College, and so as she's working on her priorities, it might be okay to table the Early Learning Center for a little bit, just as the administration gets their feet on the ground up at EVCC. I think with our close partners at the county, and then with some of the work that we've been doing with them, it might be helpful to have them join for a meeting to share more about the work for the cold weather shelters and UCC closing eventually and relocating that. So I know some of it's work that the city's doing, but
Yeah,
it's
but-
in partnership with the county. A co-op briefing I think would be great. I think many of us had requested a ride along a while ago, and their resources were too thin for us to join them, so if they can come to us, that'd be great. And then, yeah, I get questions a lot about Claire's Place, and that was another thing that we talked about at the think tank today. It was just sharing success stories about projects that go in neighborhoods that are successful
Yeah.
and that do have really great outcomes for people that are there. So just sharing the good news, I think, would be helpful for messaging and information sharing.
Okay, cool, yeah. Julie, of course, is out this week at a conference, and so, anyways, I will pass it along. They're mostly, I'll work with her on scheduling, so.
And other committee members, you have other topics you'd like included?
I don't know if this is possible, but I know with the triage center, not in use right now because of the construction, it would be nice to kind of get an update as, how we're coping with the loss of that, and if they have any alternatives, that kind of thing would be great.
Right. I think in conjunction with that, might be more of a geographical connection with the struggles that people are having along Lombard in that area. I know the city's been working hard to convene a working group to address it, so I think an update for the neighbors along that stretch and just for the community as a whole would be really helpful.
Were you relating that to?
I think it might be more of a geographip connection. Might be
Okay. I was
yeah.
like, okay. I understand that. I like everything that you were saying. Then, yeah, the Snohomish County coming in with a little bit more info updates. I'll definitely second that. Triage.
Is that enough?
Sounds good. Yeah, I'm sure at least one or two of those can percolate for next month, and then we'll,
busy for a while.
yeah.
Great.
That was really interesting what they do, Bridgeways.
Yeah, no shortage of work for them. Great. Any other thoughts, questions, comments, concerns?
No, thank you.
Great. Thanks, folks. We are adjourned. It's 5:57.